I've stayed at St. Francis all these years because it stayed true to its mission. No matter how healthcare has changed, the focus on compassion and providing the healing experience we would expect for ourselves and for our families has never wavered. Knowing the care we provide and the work we do truly matters is what makes us proud to work here.
So the actual day of the opening was incredibly exciting, and it was a picture-perfect day. The sun was shining, the sky was blue, there were just a few clouds.
Oh yes, I remember when we moved to this campus because I was part of it. I was the nurse manager of the emergency department then. It was an exciting time to move here.
And I was here at the emergency room door waiting for the first patient to come, and it was an incredibly emotional moment for me to see the first ambulance and the first patient pull up. So we opened the South Valley Health Campus 30 years ago. We had dreams about the wonderful medical center it could turn into, but the history of the last years has exceeded, I think, anything that we had thought.
So on the campus, we partner with our owners, Allina Health, Health Partners, and Essentia Health, to make sure that we've got all the essential services needed for those we serve. We've got a lot of partnerships across the community, various organizations and businesses, as well as the county. Shakopee High School actually has students on our campus. And so those partnerships really make us who we are and really define the culture here.
The things that are coming next to make sure that we continue to meet the needs of the community, currently expanding the ER. Next year we're planning to bring forward a plan to our owners to approve the addition of 12 more ICU beds, or additional 4 ICU beds to give us 12. Excited to be able to increase the access to inpatient beds here at the hospital.
The population of the community that we serve around St. Francis has quadrupled over that time frame. So you can really step back and look at it and see that we really clearly needed to expand our physical footprint, and doing that in a way that the community and patients deserve. Expert care, efficient, safe, and compassionate.
In addition to building the 1700 building on our campus, which has our surgery center as well as orthopedic urgent care, we've also invested in a large emergency department renovation and expansion project. And that will allow us to expand from 27 to 34 exam rooms to be able to meet the needs of our community for emergency care.
The community has grown, the complexity of care has grown, and that's where the ER expansion and remodel is really important.
I think we'll continue to work on the growth and continue to figure out ways to meet the community need will be the most important priority that we have probably for the next 10 years.
The other thing that we have seen change significantly is the amount of mental health issues that we are seeing patients for here at St. Francis. It really can be described appropriately as a crisis in terms of the needs for behavioral health care.
We pay a lot of attention to surveys and information that we get about the population and what's important to the community, and the number 1, 2, and 3 needs on that community health needs assessment for the last several times that we've done it have been around mental health and addiction care in the community. There just isn't enough access to those kinds of services, and so having been able to create that clinic, open it up, provides access to mental health and addiction treatment that didn't exist in the St. Francis service area before.
I guess the main changes I've seen over the years are the increase in technology and the increase in our growth.
The other place that I think has changed a lot over the years, and particularly over the last few years, has been in the robotic surgery world. We've really embraced it here and developed into a program that is an exemplary program for community hospitals across the country.
But I think the thing that is more striking to me is the increase in the complexity of the care that we're providing. The care itself has evolved, and the hospital has had to evolve along with it to come up with a more sophisticated system to provide the care, and a more sophisticated team that provides it.
So starting in 2017 and 2018, we expanded our front entrance. That was quickly followed by 2021, where we expanded our cancer center, followed by our mental health safe rooms that were built and opened in 2022 during the pandemic.